Good evening, everyone. My name is Meredith Toohey, and I'm the Conferences and Events Manager at the American Nutrition Association, the ANA. The ANA would like to thank our sponsor, Standard Process, for their support in bringing this webinar to you. Visit their website, standardprocess.com, to learn more about their dedication to the field of nutrition and whole food philosophy. The American Nutrition Association is very pleased to be hosting Dr. Christopherbaum tonight to discuss the role of magnesium in brain health and explore the underlying causes of magnesium deficiency. Dr. Christopherbaum has created a unique model of healthcare by integrating functional medicine and chiropractic care. He has over 30 years of experience in clinical nutrition and has earned numerous certifications and degrees along the way. He is a certified practitioner by the Institute for Functional Medicine, and he holds a master's degree from Columbia University in human nutrition, where he has served as guest lecturer. He also holds certifications in clinical nutrition with the AMA College of Nutrition and the International and American Council of Clinical Nutrition, and he has chaired the Council for Nutritional Education for the Association of New Jersey Chiropractors for the past 5 years. Dr. Bump continues in private practice in northern New Jersey, as well as lecturing internationally on clinical nutrition, offering unique insight from a functional and structural perspective. Welcome, Dr. Bump.
Well, welcome everyone, and thank you for participating by listening into this webinar. My name is Dr. Christopherbaum. I'm a functional medicine practitioner with a chiropractic background. So those of you familiar with functional medicine understand structural integrity. I do practice structural integrity, but the bulk of my practice is functional medicine. And I've been doing so for, dare I say, nearly 40 years. So I have extensive background in clinical nutrition, the details of which are not important. What is important is for me to share my passion, excitement, and a little bit of knowledge base on this incredible micronutrient called magnesium. And as I go through the webinar today, know that there's a few intentions that I have, and one of them is simply to share with you the importance of this mineral and how far-reaching its benefits are in clinical applications, and hence how far-reaching the deficiencies are in clinical nutrition as well when magnesium is in suboptimum status. So my intention is to share mostly science with you about magnesium, both in studies and its physiology, but not to drill too deeply with it, but enough for you to recognize and get a sense of its importance in its pathways. So with that said, there we go. I love magnesium for a couple of reasons. One of it is that I think we've evolved in a very unique way with plants. In fact, I know we have through our developmental biology. And so chlorophyll and hemoglobin share a very unique quality. And that is, here you see a slide with the hemoglobin compared to chlorophyll. And if you notice at the center, we have the iron group in the middle of the hemoglobin, and we have magnesium in the middle of the chlorophyll. But yet the protein itself is almost identical between both hemoglobin and chlorophyll. I really don't know what the significance of that is, except that I really believe that humans are so magnesium dependent and hence plant dependent that this little example perhaps echoes or validates the evolutionary component of how plants and humans have really developed, with humans being very dependent on them. So, and magnesium in its most pure form, its ionized form, will come through in plant-based sources, as in plants. An overview of its roles. Now, this is interesting for me because typically when you start to look at literature about magnesium and its influences, you'll see this magic number of 300 enzymatic actions it's been isolated to be involved with. But a deeper dive into the research would really reveal that it's well over 600 different enzymatic processes that magnesium serves as a cofactor. And its influences are from the deep intracellular influences where it's supporting DNA and RNA synthesis, cell growth and reproduction, stabilizing cell membrane, but it's also involved with energy production and storage. Most of us are aware of magnesium's influence on both nerve and muscle function, and so we prescribe it frequently to patients who have muscle cramps, for example, or are having difficulties with insomnia to serve as a bit of a calming agent in the evening or at sleep time. But we also must remember too that magnesium is intimately involved in bone growth and strength, and this plays a very important role in our elderly population where we start to consider osteopenia and osteoporosis. So I'm going to show you a few slides of a more detailed dive into some of the physiological aspects or benefits of magnesium. And this particular slide shows an NMDA receptor. It stands for N-methyl D-aspartic receptor, and it's a fascinating receptor in that it's a cell-regulating receptor. And you'll notice right smack in the center of the slide is that beautiful little green Mag++, the ion, magnesium ion. And magnesium is kind of like a bouncer, if you will. It keeps calcium and sodium and glucose. It's regulating the flux from extracellular to intracellular. But what's very important in this slide, and we'll refer to this in a little while, is that calcium ion out there in the extracellular. When calcium enters inside the cell, it becomes excitatory. It has a stimulation to the cell that says, oh, I'm in danger, I'm threatened, we need to change cell function. So when we think of a chronic inflammatory status, this is very important, because magnesium deficiency can lead to a significant influx of intracellular calcium. And the ultimate downstream consequence of this would be cell death or apoptosis. But when we think of things like neuroexcitation and chronic inflammation, neuropathies even, this particular receptor is involved. And then we can consider too cardiovascular support, not only with the smooth muscle of the vascular system. Again, remembering that magnesium is essential for muscle relaxation through its antagonism of calcium. So muscles will not relax without magnesium, adequate magnesium. So when we're thinking of cardiac muscle, when we're thinking of smooth muscle of the gut, when we're thinking of the smooth muscle of the vascular system, magnesium deficiency is implicated in tremendous amount of clinical conditions that we see, from hypertension to spasm to muscle tension to migraine, arrhythmias. And then at the lower left side of this, you see the endothelium. So the magnesium deficiencies also have a very direct effect on inflammatory cytokines, platelet aggregation, free radical production as well. And I won't belabor this slide, because usually I get a lot of back push against these types of slides because they're complex and they're detailed, but there's a few highlights that I'd like to point out here. And they're mostly in the middle right box, where you see ATP binding, enzymatic activity, RNA stability. And then on the lower right, you'll see things related to the polymerase for DNA and RNA, DNA repair. So, and these are all magnesium dependent pathways. So earlier when I was speaking about magnesium's influence on RNA and DNA stability and influences, this is what we were speaking to. Also, there's an implication on the slide that's a little bit hidden, and it has to do with the toll-like receptors and the mTOR pathway in the middle, which have to do with cell regulation and cell activity, cell growth, cell production. The point being in this is that magnesium is intimately involved in many intracellular processes, from cell regulation processes. And here we see the intracellular domain of, well, this particular slide is simply showing how frequently magnesium is involved in the generation of glucose conversion into energy through the glycolysis pathway, and then the Krebs cycle, also known as the citric acid cycle. And I've highlighted all 12 of these enzymatic paths in which magnesium is a cofactor. And then we'll look at intramitochondrial function, and magnesium again is playing an absolutely critical role in that electron transporter, electron dance. And when we're generating a real high levels of energy, of ATP, we're using magnesium in the mitochondria to do that. So we commonly refer to the mitochondria as the powerhouse. I just say it's primarily the organelle of energy intracellularly, and magnesium is in great demand for the proper functioning of our mitochondria. So when we think of deficiencies, sometimes deficiencies are very obvious, like an iron deficiency is easily measured. So would be goiter and iodine deficiencies, scurvy with vitamin C. But it's the subclinical deficiencies that often lead to chronic degenerative conditions that are of great concern for us. And magnesium falls into that arena. It's, as you'll see, it's not the easiest mineral to test clinically. I typically personally do primarily an empirical assessment or diagnosis for magnesium deficiency. I'll speak more to this in a little. But so magnesium is so involved in so many different pathways and physiological functions that we may not consider it as a major player in the chronic degenerative conditions we often see with our patients. When we think about deficiency in our population, there's lots of studies that have shown that we are in subclinical magnesium deficiency, and some authors call it a health crisis, a public health crisis. And to give you an idea of the extent of that, so in males, it's estimated anywhere from 52 to 88%, and in females, 34 to 75%. But I think it was a CDC that said that close to 48% of the US population does not consume enough magnesium. But that's based on their estimates for deficiency status, as you know. When we think about functional status, I suspect that's much higher. In fact, I say that 100% of the patients that I see walking through my office door are magnesium deficient. Fortunately, there really isn't any toxic levels, so you're not going to harm patients by putting them on magnesium. You might just have them create a bit of loose stool. But my assumption clinically, and again, I hang on to my years of clinical experience in doing this, of working with magnesium, is that everyone we see will benefit from one form of magnesium or another. So we can ask then, why especially in this culture, in the US culture, though this may be worldwide in various ways, why are we so deficient? You know, we know that whole foods are supposed to provide us with a healthy level of our macro and micronutrients. But if we look just a little bit beneath the surface, we realize that, well, one, we're not consuming enough nutrient in our foods, and we certainly aren't consuming enough vegetables and fruits, nuts, and seeds. And then the plants that we're growing in the US specifically, because these are the studies that they used to validate what I'm about to say, is that there's been such a significant reduction in the nutrient density within plants that we simply, even in organic ones, we simply don't get enough of some of these essential micronutrients. There was an interesting study that was just published in April. I don't have it as part of this webinar, but it was a Lancet study in early April where the researchers from 195 different countries were looking to see what was causing the near epidemic increase in chronic degenerative conditions that we're seeing worldwide. And these are things like obesity and arthritis and heart disease. And their question, or one of the questions they were asking in this study, was it simply that the population that they were looking at consumed too much junk food? And was that the correlate? Or was there another factor? And really what they discovered was that it's the lack of plant-based foods in people's diet that lead to these chronic degenerative conditions. So that doesn't give us permission to say, hey, go eat junk food and lots of fruits and vegetables, but you'll certainly increase or decrease your risk for developing these chronic degenerative conditions if you did eat vegetables and fruits, like Granny said. So Russell, I think his name, Borlaug, back in the 40s, was tagged this concept of the Green Revolution, and his intention was well-founded. He was wanting to create a superabundance of available foods, especially grains, for the world population, and he started he started this, what is called the Green Revolution, and he used extensively the NPK fertilization process for stimulating rapid growth in wheat cultivars. And it was wonderful, it was very successful. However, in using nitrogen, phosphorus, and potassium only as a fertilizer, you create particular problems with throwing other minerals into deficient states. And especially when you consider that phosphorus antagonizes magnesium, if you're using high levels of phosphorus in commercial grade fertilizers, and you're not repleting the soil or replenishing the soil with magnesium, it's kind of like a double whammy in terms of a negative for magnesium deficiency. So you'll see here in a second, there's a significant reduction in the nutrient levels in some of these in the past 50 to 80 years, actually. So we don't rotate, we don't fertilize with organic matters, we use excessive amounts of herbicides and pesticides. And so it leads to something like this, where the cultivars of grains and vegetables were compared from high yield cultivars to the older version low yields, and the nutrient richness in the more modern high density or high yield cultivars were significantly lower in all of the essential nutrients, both macro and micro, except for starch. That's what this slide says, and you see starch way at the top, and you see the proteins and the fats and amino acid compounds low. And the same is true with the micronutrient levels. So I've highlighted magnesium here, but in fruits and vegetables. And this was done over an 80-year, this was a 50-year period, but up to a 40% decline in the levels of nutrients due to this hybridization and the lack of good organic fertilization or replenishing of the soils. So the bottom line is that it's very difficult to get in our diets quality levels of nutrients. So we all know, and anyone listening to this webinar knows, that we really need to supplement our diets with nutraceuticals and nutrient formulas that are rich in some of these essential micronutrients that are lost due to our cultivation techniques. And this goes even with organic levels. Now, here's an interesting visual of what we're speaking to, is what a plant, a soy plant and alfalfa plants look like in adequate magnesium versus not. So there are plenty of studies, and I will show you more in a few. But what is interesting about this particular study, yes, they're pointing to the need for really looking deeper at clinical magnesium deficiencies. But what's interesting about this particular paper, without going into the details, is that they found that magnesium deficiency actually stimulates this calcium activated inflammatory cascade, leading to chronic inflammatory states. Now reflect back for a moment to that blue slide where I was showing you the NMDA receptor. That's what we're speaking to. So when there's a deficiency in magnesium, that receptor activates through calcium influx, which leads to this chronic inflammatory status. And when we know that type 2 diabetes and metabolic syndrome and heart disease, are all chronic inflammatory conditions. But what's fascinating about this study, it was despite or without of or outside of the presence of injury and infection. So just a single nutrient deficiency, such as magnesium, can have a huge impact on chronic inflammation. So well, then who's at risk then when we're speaking about magnesium deficiency? Who's at risk? And I say, well, if I'm saying 100% of the patients that we're seeing are magnesium deficient, then you can say everybody in our culture is, but there are some specifics. So I say the whole entire US population. If you travel to Europe where the soils have not been contaminated and they're still replenished with organic materials for centuries, it's not quite as a big issue. But diabetics, the elderly, because of absorption issues, the patients with chronic inflammatory bowel issues, again for absorption issues, those that drink high phosphorus laden foods like soda and coffee and dairy, and this is a crack up for me. So here we're thinking, well, we need calcium for bones, but milk is, so we drink all this milk and we're promoting all the consumption of all this milk that is also extremely high in phosphorus that antagonizes magnesium, and you'll see magnesium is absolutely essential for bone formation. So is it possible that all this osteopenia, osteoporosis is not really a lack of calcium, but really a lack of magnesium? And then there's certain medications that are also involved with deficiency status, as with diuretics, birth control pills, and some asthma medications. So what do our patients look like then, symptomatically? What do they come into our office with when they are reflecting magnesium deficient status? So you see a host of symptoms here. But patients, and you're doing physical exam, think muscle tension, tightness. You can also, anyone who has bowel-related, especially sluggish bowel, constipation tendencies. Patients with who are kind of anxious and revved up with mood disorders, insomnia. Again, we associated magnesium deficiency or magnesium function with both nerve and muscle function. So insomnia is another one that we might consider. Hypertension and insulin resistance, metabolic syndrome, and you can say that there's a lot of different conditions or signs and symptoms related to magnesium deficiency. But what I didn't mention, there's one of the primary ones, is fatigue. And anyone who has fatigue issues, regardless of cause, will do well to have magnesium added as part of the repertoire. What this slide reflects is simply the types of pathologies, disease statuses that are referenced in the literature. And these all come from different studies that I didn't want to isolate, though I'll review a few here in a few minutes. But conditions from diabetes to cancers to muscle cramping to hypertension, as I just mentioned. So speaking of studies and speaking of pathologies, what I'm going to do here for a few minutes is bore you, perhaps hopefully not, with some studies to kind of give you an idea of the kinds of work that is being done in the medical literature and what we're looking at. The oldest paper that I found related to magnesium research was one on a magnesium chloride paste that was used to treat a skin cancer back in 1919. And what's interesting about this paper for me is that they were referencing work that was 23 years earlier. So going back into the late 1800s, magnesium was known to have this anti-cancer quality and benefit. When we consider magnesium in type 2 diabetes, there's a couple different, well, there's actually a number of different ways magnesium influences us towards insulin resistance. And one can be through a deficiency intracellularly because its influence on the insulin receptor. But it has an influence on something called the tyrosinase kinase activity, which has a negative influence on the insulin receptor, leading to insulin resistance. So basically, the take home in this is low magnesium, faulty insulin receptor, increase insulin resistance. Increase insulin resistance, type 2 diabetes. Magnesium is known to have a couple different negative influences on bone function and growth. And you'll see at the top of this slide, the direct effects, and at the bottom, the indirect effects. On the left side of this slide are the number of different lifestyle modifiers that we go through that lead to magnesium deficiency, like decreased intake, gastrointestinal distress, excessive alcohol intake, and etc. So the direct effects are going to affect both the osteoblasts and the osteoclasts, which are responsible for building up and breaking down of bone. So when there's a reverse influence there through the magnesium deficiency, you're going to have more breakdown than buildup of bone. And the same is true with the hydroxyapatite crystals, which would lead to a decreased bone stiffness. So smaller size, better bone. And then there's various indirect effects with parathyroid hormone deficiency and leading to vitamin D and leading to decreased bone growth, oxidative stress, and chronic inflammation, leading to increased bone resorption. I like reviews of literature, and this particular one is looking at the effect of magnesium on cardiovascular disease. And the reason I like reviews of literatures is they do a whole lot of work for me in terms of helping me understand, in a nutshell, the benefits or not of a particular nutrient. And in this case, it's the effect of magnesium in the top study, coronary heart disease in women. So the less magnesium women have, the increased risk for heart disease. And the same is true with stroke. Increased magnesium, and these are direct, they're not inverse, they're direct. The more magnesium, the less risk for stroke. And what's also interesting in the fourth line down is that the sooner that a patient who has had a stroke is given magnesium as a supplement, the more efficient and quicker the recovery. And then there's a study showing that that increased magnesium decreases the risk for heart disease. The point being is that this review demonstrates through numerous studies the benefits of magnesium in reducing heart disease. And then there's our friend Alzheimer's. Again, a direct correlation between serum magnesium levels. Now, serum magnesium levels are not the most useful for an assessment, but if you're doing a standardization and a processing of looking at a population consistently using the same marker, you could use serum magnesium. My suggestion to this group would have been to use RBC magnesium. They would have got a better status of their magnesium levels. But the bottom line of this study was that there's the less magnesium this population has, the more likely they will have Alzheimer's. And there was a progression. The less magnesium, the more advanced the Alzheimer's becomes. So the inverse of that, with the increased magnesium, the decreased likelihood of the onset and decreased severity of development of Alzheimer's would be the inverse of that. Migraine, so there's studies, this is one of many that demonstrate magnesium's role in alleviating migraines. This goes back, probably 50 plus years, about the benefits of magnesium and vitamin B6 on the reduction of migraine. Same is true with fibromyalgia. What's interesting about this one is that it was dose dependent. The more deficient the group, the more symptomatic they were. So the more deficient this population was in this study of magnesium, the higher their complaint of fibromyalgia. So in this study, the researchers were looking at the effect of dietary magnesium and the development of these chronic degenerative conditions, again, same ones that we've been speaking to, like diabetes and heart disease, hypertension. And their findings were were simple, is that we should really be consuming magnesium-rich foods. So to me, that's kind of like a no-brainer. There's studies that have looked at fracture risk and magnesium, and this is a profound reduction in fracture risk in both men and female, 53% and 62% of those doing in an 8-year follow-up for those that used magnesium. Pretty significant there. And then there's, this is a Mexican study on the levels of magnesium associated with both waist circumference and body mass index. But there was also an interesting finding on this one, is that even in women without impaired glucose, the magnesium had a correlation with lower serum glucose concentrations, which is kind of neat. So the message there is that when you're taking in magnesium, whether you have an increased body mass or not, it helps in the stabilization of blood glucose, which is kind of huge. this particular paper is, again, it's more of the same, really, but it's speaking to, again, the increased inflammatory status in this. And I need to emphasize something, because we, as a culture, have patients coming in constantly now saying, "Oh, I'm inflamed. Oh, I'm inflamed." And, "Oh, yeah, I just know that my condition is all because of inflammation." And as clinicians, we have to remember that inflammation is a normal, healthy process. It is actually the healing process that involves pain, heat, swelling, redness, fevers, yeah, that's fever, and loss of function. So the cardinal signs of inflammation are the healing process. So of course, our patients are inflamed, but we need to remember that it is the healing process. The issue that we have is, as clinicians interested in clinical nutrition, is to look at the causation of what is triggering the body into these chronic, stuck inflammatory statuses. And this particular paper, again, is simply looking at that, especially with the magnesium and its influence as a calcium channel blocker. And again, think of that NMDA receptor. Again, that's a pretty huge one, I think, that you're getting a sense of. So again, the essence of this paper is simply less magnesium, increase inflammation. And you could extrapolate by saying that decreased magnesium, a weaker tendency towards healing. I think this is my favorite new study. It's actually not published yet. It's a work in process. It's data that is being put together by a lab in Tarrytown, New York, that's looking at levels of magnesium in the cerebral spinal fluid on rats that have been placed on a magnesium deficient diet. This was sponsored by data provided. No, it was sponsored by Standard Process Labs for this lab in Tarrytown. And the essence of this study is that they're looking at rats that are fed low chow and a low magnesium chow, and then one group has no additional magnesium, so they're going to be rendered pretty much magnesium deficient. And then there's 4 different groups that are fed various forms of magnesium, from a plant-based magnesium to some of the chelated forms that you'll be familiar with. And they did this over a 30-day trial. And this is what they found. And again, to emphasize, this is looking at magnesium concentrations in the cerebral spinal fluid up in the brain. So you see here a significant difference between the plant-based magnesium and the mag-threonate, the mag-glycinate, and the mag-citrate. And then, of course, as we would expect, the placebo is way down with hardly any presence of magnesium. The point being here, and it's significant, is that this plant-based magnesium source has some ability to cross blood-brain barrier and in an increased level, even over the mag-threonate. And mag-threonate is typically the form of chelated magnesium that is used for central nervous system issues. So I find this absolutely compelling, that food is our best medicine. And you could ask why the difference, and it's easy to understand, I think, that the magnesiums that we're taking in our food are they're ionized. They're already electrically charged, and they're not encumbered by a chelating agent such as citrate or glycinate, etc. So they're more readily recognized and more readily absorbed within the body. And when I say recognized, I mean from an intracellular, extracellular perspective. We know what to do with ionized magnesium. It's kind of like, this is what I was saying right at the start. We've grown up with plant-based magnesiums. This is the human experience. So an ionized magnesium is like, oh yeah, I'm very familiar with that. Come on in. This is more data. It's just a different way of looking at that same data, and you see the significant increase in the plant-based magnesium there in the center. So what about therapeutics? So what do we do in terms of recommending magnesium to our patients, and how are we going to process and to evaluate? So first I'd like to do is just kind of describe the forms of magnesium and where it's absorbed in. Magnesium is absorbed primarily in the distal small intestine, in the ileum. And it, as I just mentioned, when it is in an ionized form, it readily absorbs easily. But in a chelated form, not so much. The absorption of the magnesium is really going to be dependent on the absorption and breakdown of that chelating agent. So it really depends on that ligand, what it's attached to, how well it's going to be absorbed. And there's an interesting thing. We're all familiar with SIBO. If you look at statistics around small intestinal bacterial overgrowth, the primary increase in bacterial overgrowth is down in the ileum, close to the ileocecal valve, and that should suggest something to us in terms of causation of what we're calling SIBO. And I think it's primarily a backwash or faulty ileocecal valve, allowing an influx of colonic microbiome to flux up into the ileum. Anyway, the point being is that when the ileum is disturbed and inflamed due to SIBO and other GI distress syndromes, magnesium deficiency can be expected as well. So here's simply a slide showing, you know, the increased percentage of magnesium absorption. And again, this is just the ionized +2 form of magnesium in the ileum. So I get this question a lot. Well, what's the best form of magnesium to give patients? And unequivocally, I'd say that, of course, a plant-based form is essential. However, the challenge I face clinically is that I cannot get enough spinach and magnesium-rich foods into my patients to satisfy their needs. So I will use various forms of chelated forms. And I need to emphasize that all of the different forms of magnesium that you're familiar with or have access to are all appropriate, but they all have kind of various clinical benefits. So, for instance, mag oxide, which is very unstable and causes tremendous amount of hydrophilic attraction in the colon, is great, absolutely wonderful for chronic fecal retention constipation, but it's not something I would give a patient for muscle tension because it doesn't absorb well. Conversely, mag citrate would be, because of the citric acid and the influence on the Krebs cycle, might be a really wonderful form for someone with low energy. So we want to know, what the patient's needs are. One of my favorite forms of magnesium is the magnesium citramalate for patients with chronic myofascial. As a chiropractor does structural integrity work, I'm constantly faced with trying to support the myofascial complex, and the patients come in all the time with this buildup of lactic acid in their muscle, and the malate portion of magnesium malate is very beneficial for helping to mobilize or utilize that lactic acid out of the muscle. And of course, the citrate, as I just said, is wonderful for energy as well. This is a slide demonstrating what we call the stability constant. And if you prescribe magnesium in your practice, you already know that magnesium can create and will create GI distress. And we know this. And so the lower the stability constant, the more likely the patient's going to have GI distress. And really what this is about is what is the magnesium, how is it influencing, in my opinion, the water contents in the colon. So mag glycinate, for instance, and mag orotate are pretty stable. They're not going to create a whole lot of gastrointestinal distress, where mag oxide and lactic acid will create more GI distress, nausea, loose stool. So, and of course, there's how you take the magnesium, whether with food or not. I do not recommend taking magnesium away from food unless I'm using mag oxide to help with, as I mentioned, chronic fecal retention. Notice how I said that chronic fecal retention sounds very different than constipation, doesn't it? Because it is. And remember that the colon has this propensity to fill up and to bulge out. And it's a big problem. So patients can actually have bowel movement on a regular basis every day and still have chronic fecal retention. And it's beyond the scope of my talk today to go into the details of that, but know that it's something that you might consider testing and checking, and you must do that with physical exam. I actually send patients at times for a radiographic study to simply look at the shape and fullness of the stool within their colon. And mag oxide will be one of my go-to remedies for those patients. So we go, well, what is the real advantages of whole foods? As I was alluding to a little while ago, that magnesium in its pure ionized form makes sense. I mean, intuitively, we know that that is the way we should get magnesium. We should have it in its pure ionized plant-based form. Yes, of course. So the issue is, well, are our plants, do they have enough nutrients, and can we consume enough plants? And my sense is not, as I mentioned. So it's really, although we prescribe whole food diets, organic and biodynamic, inevitably with certain nutrients like essential fatty acids and magnesium, often B vitamin, we end up needing to supplement our patients. I had mentioned testing earlier, and I said to you that I typically will do an empirical assessment, as I had this attitude, everybody needs magnesium, so I don't really do a lot of testing. But this slide simply shows the various forms of mag testing, with serum magnesium being the least efficient, where the EXA test is probably the most efficient, but it's rare and expensive. So for our sakes as clinicians, the red blood cell magnesium is the least expensive and most efficient, in my opinion, for assessment of magnesium status. And we want to see it over 6. So RBC magnesium is readily available in any of the reference labs, and it's, as I mentioned, very inexpensive. The tolerance test and the EXA test are, I won't say that they're still kind of in the research clinical realm, but they pretty much are. They're not readily available to most of us yet. But like I said, just put your patient on magnesium, you'll do them a lot of favors. Dosing, again, this is RDA. It's challenging as a functional medicine practitioner to really gain a sense of what kind of nutrient density or dosing that we need to prescribe for patients. But if you use an RDA type of or CDC type of reference, this would be it. So adults, males, you're looking at upwards of 400, 500 milligrams a day safely. Females a little less, 300, 350. I typically will do a 500 milligram dose a day, divided dose, 125 milligrams, 2 capsules twice a day, depending on severity of conditions, as well also depending on body mass and age, history of gastrointestinal distress. So though I offer this recommended daily dosing, know that as clinicians, it's really up to us to make our clinical judgment on how to dose our patients. I don't typically suggest using bowel tolerance as the dosing unless a patient has, as I said, chronic constipation issues and fecal retention. Otherwise, it's very uncomfortable for patients. So in summary, what I'd like to conclude with is simply reminding you of what I've gone through over these few minutes of sharing with you. And one is, I can't emphasize enough how absolutely essential and important magnesium is. In fact, I would go so far to say that as a clinician, if I could only recommend one nutrient to a patient and none other, it would be magnesium. Essential fatty acids are a close second, but because essential fats are readily available in fish, it's more easily absorbed or gotten through diet, but not magnesium. So it's that important to me. Secondly is how absolutely involved, when you think of magnesium, think of it being involved in every single process within the body, period. So if someone, no matter what the condition, just say, oh, you need magnesium. And whatever the condition, you need magnesium. It's going to assist. So the other take-homes in what you've heard today is that the various forms of magnesium are important to get a sense that each of those chelated forms have different therapeutic values. But that, again, I'm going to come back to the plant-based ones are the most efficient. And knowing that the addition of magnesium as a standalone often can help ameliorate many different kinds of conditions, but it is primarily a cofactor that you will see essential in your management of your patients. And I want to thank you for taking the time out of your busy lives and schedule to listen to this webinar, and I wish you well and all the good work that you do.
Thank you, Dr. Bump. Truly fascinating and very helpful information. We invite our audience to learn more about your work at drbump.com. Good night and best of health to you all.